So I'm Krista Williams, and this is going to be my wound dressing demonstration video. Okay, so I won't be doing any removal of a dressing because we're going to say this is a fresh wound. I know it is all red, but this is the only Play-Doh I could find, and so it's not skin colored. Okay.
Mm-hmm. Okay, it's on the Play-Doh now.
Okay, so I would walk in the room, I would identify the patient with 2 identifiers, meaning I would look at their bracelet and I would have them say their name and their date of birth. I would double check the doctor's orders. I would assess the patient for their pain and if they had any allergies. I would provide privacy for them. My supplies are placed on a clean surface. I'm going to inform my patient that this is going to be for wound care and we're going to do the dressings for their wound. I would answer any questions they would have for me, and I would gain their verbal consent to be doing this. Okay. If we were in a hospital setting, I would have the bed raised. I'm sitting at my table, so we're not raising any beds. I'm going to perform hand hygiene. We're going to pretend that I'm doing that. And now I'm going to don my gloves to do the measurement and assess the wound site. The color of their wound is red because it's red Play-Doh, and but if this was a normal skin, it should be skin color on the outside, probably red around the edges here where it's torn, and on the inside should be red as well. So that's the color. Odor, I would assume, since we're saying it's a fresh wound, it should not have an odor currently. And because it hasn't been sitting for very long, consistency, it would be probably very wet in the inside because of blood still kind of forming, and probably some serous fluid or serosanguinous fluid. Okay, there's no eschar because it is a fresh wound, so there's no black around it. There's no sloughing currently since it's still pretty fresh wound. No tunneling or anything of that. So now we are going to measure. We're going to use the Q-tips, and I'm first going to measure the length. So we're going to hold it at the point that it is. I'm going to just use the ruler on the back here. The length is approximately 10 centimeters. We're going to do the width now. The width at the largest point, so I'm going to do it, and that is approximately 2.5 centimeters. And now we're going to do the depth at the deepest point. It's about there, the end of that Q-tip there. That's about 1.5 centimeters. Okay, so I would dispose of this in a trash receptacle. Okay, and I would remove the gloves. And if I had any dressings on here, if it had a lot of bleeding in it, the old dressings, I would throw them in I would throw it in a biohazard container. If it only has a little bit, I'd throw it in the trash, and I would wrap it in my gloves, and I would discard of those. Okay, if I needed to don PPE and a mask and and eyewear, I would do that, but I'm not going to. I would wash my hands again, and I'm going to open the sterile field. And I'm going to put that down. That one's going to go over there for right now. And I would place my container on the sterile field. Q-tips to put in the gauze. My other Q-tip's gonna stay there. This, I need to loosen my saline solution. Right now. Okay, and now we're gonna put on the sterile gloves. We're gonna do your non-dominant hand first. But that's okay. Just practice. Okay, so
Yeah, just practice.
I'm gonna do my non-dominant hand first. I would touch the top of this, make sure the label is facing me so that any water drips down it. It will drip down the other side because as soon as paper touches in all of this, it becomes non-sterile. So I'm gonna pour a little bit into my container here. My cap is facing up the way it's supposed to be too. And put that in here. So we're gonna do 2 gauze sheets. Probably only need 1 actually, besides my room. We're gonna do 1 gauze sheet, make it damp in here. Place that on the side of our sterile field for right now. Squeeze out the excess later. Another one of these gauze sheets will be used to place on top. And then we have the abdominal padding that's gonna go there. Okay, we're now gonna place on the other glove. A little bit too small. Extra small. Okay. Okay, so we're gonna have our wound. Place this in front of me. Have our wound. We're gonna squeeze out the dressing a little bit more. We're going to fluff it by undoing all the layers here. Find them. I'm going to fold it. Nice little layers. And then I'm going to accordion it up. So that when I pack my wound, it's easier for it to come apart. Okay, so now we would take the other swap out. We would place this in here. You can use your fingers when you have the sterile gloves, or you can use the Q-tips to do it. And you would pack this in there as you're going. The side closest to me is, we're gonna say, is the bottom of it. So the most fluid would be reaching the bottom when they stand up. Okay, now we're gonna have another one. Another piece of gauze. This will be the dry, so the wet was on the inside. This is going to be the dry gauze. And we're going to fold it so that there is a extra double layer at the bottom, like so. And so this is a little bit bigger than my wound is, but if it was a little bit bigger of a wound, you would just drop it like so, and you wouldn't move it around. Wherever it lays, it lays. But the double layer is at the bottom, so that it would pick up more fluid if there was discharge. Okay, and then next I would put my abdominal pad in there, and try not, even though I just did it, try not to touch the underside. The blue is the sky part, and that goes on top. And you would lay that on top of it. And you can press that down. Now, if this was on like a foot or something, you would maybe rotate, but we're gonna pretend this would be maybe an abdominal or a back one, or a bigger portion of the thigh, so you can just leave it alone there. And then you would secure this with the tape. Just gonna secure it to my table. right now. Oh my goodness. So you just secure this to the table. We're gonna pretend is their abdomen or something. And that is the wound dressed. You would label it and you say the time and date and, that you changed it at. I'm going to then discard my gloves. I would wash my hands again, make sure the bed is in lowest position, rails up, locks on, call light within reach, just in case they need anything. And that would be the end of that.